Just want to first acknowledge that this workshop was created with support from the Canadian Institutes of Health Research, as well as the Pacific Institute on Pathogens, Pandemics, and Society. And you can access other workshops within this series at the YouTube link found on your screen. I also wanted to acknowledge the land on which I reside and work and play. I am affiliated with the University of Guelph, as well as live in the city of Guelph, which resides in the treaty lands and territory, of the Mississaugas of the Credit. And we recognize this gathering place in which, we work, we learn, we play, that it's home to many past, present, and future First Nations, Inuit, and Métis people. And you can see as well support from the Institute at Simon Fraser Institute also respectfully acknowledges the land in which they reside. So I'm super pleased today to present a snippet of information from my guidebook, which is titled Social Media Crisis Communication Guidebook for Public Health. During a time of crisis and uncertainty, the greatest asset we have in public health is trust. Trust impacts the speed at which we can move through a crisis, and communication is actually a fundamental influence on trust. Trust in government, in politicians, public health, and healthcare have not surprisingly to anybody listening, but they've all declined over the pandemic. And this is in part due to inconsistent and ineffective communication. So I'm Melissa Mackay. I'm currently a postdoctoral scholar at the University of Guelph within the Health by Designs lab, which is in the Department of Population Medicine. So there's a few learning objectives today. I want to help you understand sort of the best practices surrounding effective crisis communication via social media to demonstrate trustworthiness. And we'll do this through understanding a four-step process that I created based on a lot of different evidence, including scoping review to understand the best practices for crisis communication on social media during emerging infectious diseases, as well as research on Facebook, Twitter, and Instagram with a wide variety of different official sources and non-official sources, including news media, public health, government, politicians, brand influencers, science communicators, so quite a range of communicators. And then throughout this, I'll ask you to sort of pause at a few different slides so that you can assess the communication and see if you can understand, what's being shared. And we'll get into that further. You may want to access the guidebook itself. I put a link there in case it's helpful for when you're assessing some of the different social media posts that I've included against what I call guiding principles or some of the theories I'm going to talk about today, and we'll introduce those in a few minutes. So communicating in a crisis is different than other types of health communication. High levels of uncertainty result from new and unfamiliar risks, such as emerging infectious diseases like COVID-19. And during a crisis, people are taking in information differently, they're processing it differently, and they're actually acting on it differently, of course. And some of this difference relates to fear and how that actually impacts our ability to process complex information. And within the information landscape, especially now within our globalized and highly connected society, we're also being exposed to massive amounts of information. And as you know, some of it is factual, but a lot is false and sometimes deliberately misleading. And our ability to sort of cut through this complexity relies on the trust that we have with individuals and our ability to effectively communicate. So false information was incredibly abundant, as you know, throughout all the waves of the pandemic, but definitely the first waves. And you are aware of this in British Columbia, but early in the pandemic, photos of Dr. Henry taking a helicopter surfaced, and then the quote, "Do as I say, not as I do," was added and circulated widely. And it was falsely asserted that she was actually taking this private helicopter to go home to visit her family. It wasn't true. She was actually just going home after a COVID briefing in Vancouver. And then there were so many other rumors, lots around that Dr. Henry was going to issue stay-at-home orders, and this, persisted and were widely circulated through social media. And as you can see, through the protest signs and all the commentary that we saw, it all contributes to undermining our public health response and the trust that we have with our communities. So crisis communication is an audience-centered approach that occurs as part of, managing a crisis where we're putting public health measures into place to either prevent or to mitigate harm. And it's largely based in sort of uncertainty about hazard. So trust is a fundamental sort of outcome of effective crisis communication. And really importantly, it influences the perception of, the measures that we're taking, the perception of individuals' risk with regards to the hazard, and whether or not they're going to actually adopt the behaviors that we want them to. So a public health emergency is distinguished by rapidly evolving situation, super high information needs, and uncertainty about the hazard and what we need to do to either prevent or mitigate it. So within that uncertainty, transparency and being consistent in our communication is extremely important aspects of communicating this uncertainty. And that's kind of defined as communicating what we know, but really importantly, what we don't know, how we're going to go about finding out the information, what the gaps in our knowledge is currently. And this primes people to sort of accept the scientific process, and that as new information emerges, we will share it with them. And it's not sort of a fault of the response, but it's just by nature of learning more as sort of we go and the research emerges. So inconsistent official communication was a big problem throughout the pandemic. And I know I'm preaching to the converted here, but we're all aware. But on the left, you can see Dr. Tam's original recommendation in, I think it was March 2020, not to wear a mask. And this was due to needing to, to have personal protective equipment within healthcare, and also kind of fear that people might not do it properly and that would actually spread disease. And when we assess the communication from federal public health, that information wasn't shared across the social media networks, like the information not to wear a mask. But the first instance is that we saw, or that we found, with regards to mask wearing, you can see on the right-hand side. And the first one was about wearing a mask when you are traveling back into Canada. And then the next one was more broadly the recommendations to wear masks, when you have to go outside the home. So there was no real, within the social media landscape anyways, there was no mention of that earlier recommendation not to mask. No acknowledgement of, we didn't really understand the hazard or COVID-19 at the time, and if masks would be effective. Now, maybe we have our personal protective equipment supply, well laid out, and now we are recommending masks. There was no, direct acknowledgement within the social media posts. And, this is creating an inconsistency, or this perception of inconsistent communication, as we're not directly acknowledging the change and why we're recommending something different. So this is really undermining, our public health response, our trust, and creating a lot of confusion. And, when you assess the comments on posts like this, you see that reflected in, our community's comments. And, another example, conflicting messages and changing recommendations have been widespread, especially in Ontario, where I live. So a stay-at-home order that went out in April of 2021 read, only leave home for essential purposes such as food, healthcare, vaccines, exercise, or work. And you can see sort of the contradictions by the tweet on the right saying, do we really need an emergency alert for our emergency break, emergency stay-at-home order? And then others saying, I'm literally like teaching right now, or I'm literally out shopping and I just got this. This doesn't make any sense. We didn't get enough warning. So, The province's intention was to get us all on the same page about staying home, stopping the spread, mitigating the harm. But actually, it, further created distrust in some members of our community who were already sort of fed up with the mandates and the government actions. And these thresholds for, the various levels of mandates that we had in Ontario were never shared. So they were never transparent, further creating sort of confusion and distrust. And, nobody could anticipate when changes were going to happen. So importantly, there is an assumption sort of that skepticism towards science or public health is a result of lack of information, and that if we just kind of throw more information at it, the public will then follow our advice. But if you kind of reflect on the information landscape, and as I previously mentioned, we have this huge abundance of information, especially about COVID-19, from a huge number of speakers, across all kinds of different channels like social media, news media, etc. So the issue actually isn't that people are not, getting information about it. It's that they're questioning the trustworthiness of the information, of the science, of public health, of government, because we're not applying sort of these effective crisis communication principles to our messages. We need to demonstrate our competence and the willingness to act in the best interests of the public through detailed, honest, and balanced, but also really importantly, information that's tailored to our communities. So I thought this was really interesting. This was a study by Levitt et al. In 2022. You can see a link to the study at the bottom right there. And it showed some really interesting results. So on the perception of effectiveness of government response in Canada was shown on the left. And then on the right, you can see compliance with guidelines. So really interesting. You can see across the 5 different time points that perceptions of government response went down, down, down across the 5 time points, with the red sort of being people perceiving it as very ineffective. So the government response was very ineffective. So that, proportion of the population that viewed them as ineffective grew over those 5 time points. And at the same time, compliance significantly decreased. So compliance with public health measures and government, recommended behaviors significantly decreased as well over those 5 time points. So, while there's many factors that are influencing sort of people's perception of government effectiveness, one of the key things that is public health communication and our ability to effectively communicate. So providing the right information, via the right communication channel that reflects our audience needs and values is really important. The issue of skepticism to science and institutions is not merely one of missing information. So this issue of trust or distrust is really central. And effective crisis communication can demonstrate sort of the mechanisms of trustworthiness, and that's through kind of co-creating the crisis response. So engaging in two-way communication with our communities so that we can, represent shared values, have, shared decision-making wherever possible, show concern, and really be transparent and consistent through our communication. So you can see here, I pulled some examples from a quick search on Twitter, just with some keywords: trust, COVID vaccine in Canada. And there was an incredible number of results, as you can imagine. And, you can see through these examples, specifically regarding COVID vaccines, hesitancy was fueled in a huge way by distrust of public health, of government, of the politicization of vaccines, and, just fear and mistrust of the pharmaceutical industry. And, in a huge way, this distrust was really, in part, lack of effective communication that really met audience needs and values. So you can see saying the vaccine's rushed, or that natural immunity isn't accepted, and lots of different instances of where we have failures in communication and we're just not providing, information that's matched to our audience needs. So effective crisis communication during a crisis can save lives, literally. And because trust is the most important outcome of, an effective crisis response, and that's because it's directly influencing risk perception. So whether or not people feel like they might get really ill, through engaging in, various activities, and it really is impacting whether or not people are going to engage in the either recommended or sometimes mandated behaviors. So we're competing against media, celebrities, influencers, conspiracy theorists, anti-vaxxers, and others, especially online, for attention. So we really have to have this creative, coordinated, and importantly, a transparent approach to our communication that better meets the needs of different subgroups within, the communities that we're serving, and is overcoming the mis and disinformation, or that false and sometimes deliberately false information. And selecting the right spokesperson is incredibly important. This is very apparent in the research that exists. And one thing that hasn't been widely explored, but that I think really should be, and I'll talk to you about why, is partnerships between public health and maybe other trusted organizations, but sometimes other trusted individuals, that can boost the credibility, of our message, and really importantly, the reach of our message. And sometimes those are to like hard to reach subgroups that have strong networks on social media. Physicians, celebrities, brand influencers, sometimes media, and sometimes politicians, when they're viewed favorably by, the public or a subgroup, can all have really positive impacts on risk perception, whether or not people are going to share the message on social media. So that really impacts, getting into networks that you aren't already in, how much engagement people are, how much people are engaging with your messages. And then also if they're adopting the behaviors that we're recommending. So the guidebook that I linked to at the beginning outlines this 4-step approach to draft crisis messages that are audience-focused, they're evidence-based, and they're sort of feeding back into the process where you can understand how to kind of increase the positive response and engagement to your messages on social media. The guidebook has much more detail than I can go in today, but I'm going to kind of provide you with an overview. Excuse me. Okay, so the first step is to conduct an audience segmentation. So we know that our audience judges crisis messages based on the content of the message, the messenger or the spokesperson, in other words, and the communication channel that's being used. So that could be news media, it could be social media, etc. So it's essential we really understand the information and communication preferences of different subgroups within our communities that we're serving. And that includes, the channels that they want to receive information at. And this will increase our message reach and ultimately the impact. So in public health, we often use demographics, so age, gender, education level, income level, etc., to understand audiences. And that's great, but we may want to take it a step further to really, get to know our different, subpopulations in a more nuanced way. So segmentation involves dividing a larger audience, so a community, let's say, based on their similarities. So it could be behaviors like, engaging in vaccination or not, let's say. Could be needs, opinions, values, social determinants of health, and importantly, demographic information as well. So this is really supporting developing crisis messages that are more nuanced and suited to, various subpopulations' needs, which, is going to be much more likely to result in behavior change. And as I mentioned before, having messages that are well, suited to audience needs and the values are going to really increase the potential for engagement on social media and that kind of organic spread within networks that you might not already have access to. So really importantly, we need to work together with different subgroups within our communities to better understand their needs and do this kind of co-creation of the crisis response. The one-way push model where, in public health, we're designing communication and then we're just putting it out there on social media or a website isn't meeting the needs of everybody within our communities. So involving groups and really doing this segmentation to understand, the communication needs should really be worked towards so that we're providing nuanced and relevant information. So differences among people like culture, demographics, and other characteristics impact the way we communicate, the way we respond to information, and understand information during emerging infectious diseases. So this audience segmentation reflects sort of a deeper understanding of these factors. And really importantly, that understanding can be used to create more culturally relevant crisis messages. So as I kind of mentioned before, partnerships with trusted spokesperson have been found, to better meet the needs of different subpopulations. So these could be influencers, physicians, faith leaders, even various diaspora, like, immigrants living within a country. And sometimes even celebrities have all been found to, be trusted and credible and be able to really take good public health information, but craft it in such a way that it's, genuine and more relevant to the population that they're connected to. So next, you're going to draft your messages with guiding principles and theory. So first, I'm going to talk about the guiding principles. This was developed through an extensive literature review looking at best practices for crisis communication on social media to kind of demonstrate trustworthiness or maintain trust. So first, we need to be transparent, sharing what we know, but what we don't know, and how we're going to go about finding the answers. We also need to show compassion and empathy. So, showing people that we care and that we're going to help them however we can sort of overcome challenges that they're facing. Being clear and concise. So ensuring we're using the appropriate language and that information is really tailored to different subpopulations. Being timely or being first even, the research shows that the public often remembers and trusts the first source of crisis information they see. And then also we need to directly, assess what kind of mis or disinformation or, false information is spreading within the community and address it and correct it. So these guiding principles are interrelated and likely sort of function together. But through our research, we found that increasing combinations of these guiding principles increase the odds of positive message response. So the more you sort of incorporate these into your crisis messages, the more likely people are to respond positively within the comments to the messages. Okay, so we're going to look at a few examples. So take a minute and pause this and assess this communication to see if you can guess what guiding principles were used in this post. So take a minute and pause. Okay, you're back. So this post used call to action, clarity, compassion and empathy, and conversational tone. So you can see conversational tone saying you, we, using contractions. Compassion and empathy is really acknowledging the difficulty of parenting and working from home and homeschooling all at the same time. Clarity was using mostly, it was, tailored towards parents, but it was short words, short sentences. And then call to action was see link in bio. So it's asking the audience to do something as a result of the information. So if you were to reflect on How this could also include transparency. How might you do that? So you could pause again to give a think. Um, but to be more transparent, the post could have maybe included information about um, what the survey is for and to what end. So is it, ultimately to provide resources to parents or to better understand, um, what challenges parents are facing? For whatever reason, they could have been more forthcoming with that information and sort of what questions it was going to help answer. Okay, again, take a minute and assess which guiding principles you think this post includes. So go ahead and pause and then come back when you're ready. So when I assess this post, I think it has call to action, conversational tone, and transparency. And across Twitter, Facebook, and Instagram, across a wide range of different, sources, rarely found transparent communication. So this is a great example. So transparency is shown here by clearly indicating that the research is ongoing and that things may change, but the best available evidence that we have right now is showing that, yeah, we think COVID can live on surfaces for a long time. And here's what you need to do about that. In call to action, there's that link for more information and that kind of direct request to do something as a result of the information. So this is really helping show that kind of balanced information about what we know, what we don't know, and kind of cues the audience, the reader, that the evidence may change in the future depending on the science, so that at that point we may make a different recommendation. So as I mentioned earlier, the guiding principles and theory can help us to develop crisis messages that influence behavior. So in the guidebook, we go into a lot more detail about two models. You're likely familiar with the health belief model, and the extended parallel processing model is the other one. So I'm going to focus on the extended parallel processing model now, but like I said, you can go into the guidebook for more details. So crisis messages should provide information about the threat of the hazard, so in our case, COVID-19, and that is a combination of severity and susceptibility information. So severity information is information about health and social consequences of the disease, where susceptibility information shows an individual that they're vulnerable, and that can be number of deaths, impact on certain populations, and even like the spread of disease within a community. And then we also need to provide cues to action and efficacy information. And that helps people, prompts them to engage in a behavior, but also provides information so that people feel like they know how to actually engage in that behavior and that they're able to do so. So the extended parallel processing model says that when messages demonstrate high threat in combination with high cues to action and efficacy, individuals are much more likely to engage in the recommended behavior. But if one or both of those areas are low, people can respond either defensively, reject the message altogether, or ignore it. So when thinking about that sort of combination of threat, so severity and susceptibility, in combination with cues to action and efficacy, let's pause here on this post by Science Sam and see if you can assess whether the threat and cues to action and efficacy were included. Okay, so this post included information about the threat. So there is severity information about, lives being saved, impact on healthcare systems was more in the susceptibility realm, but there wasn't any cues to action or efficacy information. So you can pause again and sort of reflect, like, how might you suggest, if you were crafting this post, how would you include some efficacy information or cues to action? So in my reflection on this, I think it could be simple. A photo of Science Sam either at home, as was mandated at the time, or possibly masked. Just following some of the public health advice that can cue that action in others, and support her message here. Okay, so let's also do the same with this post by Healthy Canadians. So we'll pause here to assess the severity and susceptibility, as well as cues to action and efficacy information. So this post has excellent severity, susceptibility, and cues to action efficacy information. So the severity is communicated in the line, even young and healthy people can get really sick from COVID. And the susceptibility information is conveyed in the right now, 20 to 29-year-olds have the highest infection rates. And the cues to action can be found in, it's important to keep taking precautions, wash your hands, physical, distance, etc. So all of our research sort of that examined the social media crisis messages for use of guiding principles found that they're related to the public's emotional response to messages. And that is found through something called sentiment analysis. And so we know that each message really should aim to sort of incorporate the relevant guiding principles. So relevant to the topic and relevant to the intended audience as well. Ultimately, not every message needs to incorporate every guiding principle. We don't always need to be correcting misinformation, for example, but clarity, so that, using clear language and tailoring the information to different audience segments, a call to action, so a link for more information, or asking, the follower to do something as a result, using conversational tone, so first person, contractions, balancing friendly with professionalism, being timely, and then really important, being transparent, as much as possible should be incorporated. So like I said before, when we did research on Twitter specifically, we found increasing combinations. So 2, 3, 4+ guiding principles were associated with higher odds of positive engagement. So that shows, increased message acceptance. And then the application of sort of that threat and cues to action, as well as, others from the health belief model, can really help increase message relevance and ensure that individuals understand their personal risk and that they know how to take action. And research that we did on Instagram by a range of different accounts found that posts that included information about severity, cues to action, and then also address any benefits or barriers were all associated with significantly higher positive emotional response to those messages within the comments. So the third step is to choose your channels. And this really happens within audience segmentation, but then in also engaging with these audience segments. So we know public health audiences are highly segmented. So we need to select platforms to really reflect this. And, at the same time, we understand that highly segmented approach to public health communication is difficult, maybe not possible. So sort of a layered approach where messages that are intended for general public are used sort of in combination with a segmented approach. And that might be much more realistic. So it's really important to use those social aspects of social media to connect with communities, to foster connection between followers and between public health and our followers. Responding to follower questions and messages. So follower questions maybe within the comments or a direct tweet, or messages through Facebook or a DM through Instagram, etc., is a really important way to foster this connection. Provide super relevant information because you're directly responding to someone's question or statement. You can really correct misinformation at that stage as well. And ultimately, it's fostering trust. And when we examined replies within the research that we conducted, we found pretty much, no, none of the official sources that we looked at, so public health, news media, politicians, etc., no engagement within the replies. So if people asked a question directly within the comments, we never saw instances where those official sources were replying. And then finally, the last step is to monitor and evaluate your efforts. So as I kind of mentioned earlier, analyzing the sentiment or the emotional response can really help, you assess message acceptance and how people are feeling about your social media crisis posts. And as you sort of monitor sentiment, and can be really easily done through platforms like Hootsuite or Buffer or anything that you're using to sort of manage your social media. But it helps you get a better understanding of how followers are sort of responding to different types of messages, possibly different guiding principle combinations, use of theory, maybe using humor, that kind of thing. And it's really important that you sort of do this because negative comments on social media posts are known to sort of persuade others to also view that information in a negative light. So people sort of jump on the bandwagon, as you will, and sort of it taints their perception when they see that others are responding negatively. And then engagement metrics, so things like likes, shares, retweets, number of comments. This shows you how actively involved your audience is with your content. And really importantly, people are using engagement, so reactions, comments, shares, etc., to evaluate your content. This information, this engagement information, is directly influencing other people's attitudes towards not only the content of your social media post, but the source. So, us in public health. So monitoring sentiment and engagement will really help us to understand and then incorporate aspects of crisis messages that we know are increasing the positive sentiment within the comments and the overall engagement. This helps increase the reach, both organically within other networks and within, your followers on your accounts. And, as I mentioned before, replying to negative comments to provide clarification, to address misinformation, provide resources, etc., is going to increase, hopefully, understanding within that individual, but also offset sort of that influential effect that negativity has on your other followers within your community. So, fast and furious through this 4-step approach to define our audiences, draft our crisis messages using guiding principles and theory, selecting the appropriate channels, and then monitoring and evaluating so that we can increase the positive response and engagement to our messages. So overall, this is helping you meet your audience needs and receive positive engagement overall. And as I mentioned earlier, we need to leverage the social aspects of social media to increase engagement and the positive response to our messages. And, it's time that we explore partnerships with trusted spokesperson, both, more traditional and typical, but also to get out of our comfort zone a little bit and explore, brand influencers and people that are trusted and credible within their own community networks. My email is on the slide, as well as the link again to the guidebook. If you have any questions, please reach out. I'm happy to sort of engage in conversation and answer any questions that you have. The guidebook has a huge list of references, including all the references that were part of the scoping review that sort of laid the foundation for this work. The first reference is the overall scoping review that I'm talking about, and then the rest of them are the specific studies that we did on the various social media platforms, Facebook, Twitter, and Instagram. So feel free to check those out. I just wanted to acknowledge that this particular research was funded by SSHRC, and we had a ton of amazing collaborators from the University of Guelph, from the Canadian Public Health Association, and from the National Collaborating Centre for Methods and Tools. So thank you so much. I hope this was useful. I know it was a lot of information, so please do reach out if you need any clarification, and I hope the guidebook is useful. So thanks so much, and take good care.